If you were to describe that to anybody who's never had that done before, what would you tell them?
It's basically you can feel your vertebrae separating apart all the way down. It's really neat. More range of motion.
Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. So he's actually a chef and in a kitchen a lot, so you gotta realize, like you were telling me before with the pain that's going on, you're bent over, kind of just slightly bent all day cooking.
Right.
Now I know you came from quite some distance as well too.
Yes.
Came from
Pittsburgh, Pennsylvania.
Pittsburgh, Pennsylvania, so that was quite a drive to get to Spartanburg, South Carolina. But yeah, so today now your primary chief complaint is mid-back, more right-sided, and kind of like as you were describing to me, like a rib pain.
Yeah, and pretty sharp at times. Almost disabling at points.
Okay, and there's been about 4 or 5 months?
Yeah.
Okay, so 4 or 5 months you haven't been able to get rid of this type of pain at all.
Mm-hmm.
It's just been on and off, correct?
Right.
Very intermittent, it doesn't really follow a schedule.
Yeah.
But yeah, when it hits you, it's sharp.
Hard.
Yeah, and it hits hard.
And even sometimes when I try to stretch it out, that seems to make it worse.
Okay, so even stretching it is making it worse. Alright, so what I want to do, like I know you were showing me before, but I just kind of want to have everyone see as well.
Okay.
If you're to stand up, I know just some of those stretches, just how it's hard for you to do some rotation, just like that.
Sure.
Yeah, so I just kind of want you to show viewers at home, what's going on. So even that.
Yeah, it's really tight up in between the shoulder blades.
Okay, so it's pain right in between the shoulder blades, more right-sided. And now you're telling me you're starting to feel that pain from here, starting to go.
Yeah, it's been radiating up into my neck.
Okay, so it's now starting, not just in that mid-back, but now going up to the right side of the neck. But it is everything just on the right side.
Okay.
So, okay.
Yep.
So what we're gonna do, now I do things 2 ways. I like to work on the muscles and the tissues, and I like to use the that massage device.
Okay.
So we're gonna first go at it with that.
Sure.
After that, we're gonna go ahead and do the adjustment. Sound
Okay.
good?
Cool.
Perfect. I'm gonna have you lay face down for me. Okay. So before we start that massage device, how I like to start all adjustments, I like to just scan the entire body, okay? So we're gonna look at the right side to the left side. We're gonna be feeling for, that muscle tonicity, feeling for any taut, tender fibers. Let me know if anything that I do, if it is tender, like tender to the touch while I'm palpating, okay?
Okay.
So starting up in that upper cervical area, any pain through this?
No, not at all.
Good. Okay. So from that cervical spine, we're going into the thoracic spine. Yeah, I definitely feel some tightness with that trap, with kind of the muscle fibers, but even on the left side too. So that is kind of, in your profession, especially with what you're doing, I could imagine, that you're always
Kind of half bent over.
Yeah, always, exactly. Okay. Now let me know if any of this is painful. Okay. So from that thoracic spine, getting down to that lumbar spine, and now to the sacrum and the SI joints. So if I push in on the right side, any pain over there?
Not pain, but I can feel the discomfort in there.
Okay, no pain, just a little discomfort. If I push directly over the sacrum, any issue there?
No.
Or on the left side?
No.
Okay. Alright, so what we're going to do, we're going to come down to here, and we are going to check the leg length. So it's a little bit short on the left here. So, a little bit short leg on the left, not by much, but just a little bit. As we're scanning up the body, so it's a little bit, the right side is hiked up just a little bit here.
Okay.
But that's, it's pretty symmetrical, which isn't too bad. Just got to worry about that left short leg, and then also we gotta really just kind of go at a lot of these taut, tight muscles in here. Now I know primarily that spot that's really bothering you is about right in here.
Right about there, yeah.
Right about here.
Yeah.
So, I know you guys may not hear you feel him or hear him kind of gasping a little bit, so I'm not going to sit there and keep pushing in on that spot. Obviously, we know where it hurts him, and that's going to be that chief complaint there. So let's go ahead. We're going to use the massage device. Just kind of relax everything first, and then we'll start with that adjustment. There we go. How'd that feel?
Yeah, pretty good.
Pretty intense, right?
It is.
I know, you don't really kind of notice it when, obviously when you're viewing it from home, but yeah, that little guy's pretty powerful.
It certainly is.
Okay, so we're gonna start off with the adjustment. I like to start everything right at that cervical thoracic junction. So we're gonna do the T1 right here on that left side first. Good. Drop down just a little bit here. T2 on the right. Perfect. A lot of good movement there. Feel that pressure just getting off those nerves. Okay. So I'm gonna have you take a deep breath in and exhale all the way out. Good. One more time, deep breath in and let it out. Okay. Yeah, through here, what I'm gonna do, we're gonna do it the, so I'm doing a thoracic, prone adjustment. Prone just meaning he's laying face down. What we're gonna do, we're gonna try the anterior thoracic adjustment. That may actually help a little bit better for him. What I wanna do, we're gonna come all the way down to the sacrum. I'm gonna stabilize on the sacrum. I want you to raise this leg up as high as you can for me. Any pain, tenderness, tightness with that?
No.
Alright, relax that side. Raise the left side for me as high as you can. Any pain, tenderness, tightness? Okay. Now, I don't know if you noticed, but this left side actually went up a good amount higher than the right.
Yeah.
Okay. So, no pain, but that this side is kind of a little bit kind of restricted. What I'm going to have you do is I'm going to have you cross this right foot over the left foot for me. Good. So, I want to work on that sacrum, because what that's telling me, if you want to look up real quick, what that's telling me is, so your sacrum is pointing more towards that left side.
Okay.
What that does is the ligaments that are coming across from the sacrum, right on here, onto the femur,
Yeah.
it's on the right side, the fibers in the muscle is looser here, which is allowing that leg to actually raise higher. but when it's pointed over here, now everything on this side is actually
Okay.
taut and tighter, so you're not able to raise that
Yeah.
leg as high. So all we're gonna do a P to A drop on the sacrum, and we're gonna do a torque technique so we can torque that back to midline, okay?
Okay.
Alright, so yep, I'm gonna have you cross that foot over again for me. Good. And table's gonna come up from below. And so that everything is going to the left side, what we're gonna do, we're gonna do that drop going down, and we're gonna give it a counterclockwise torque here. Good. Uncross your legs. Bend this knee for me. Yep, just like that. One more. That table dropped too quick. There we go. Perfect. Alrighty. So now, we're gonna stabilize on that sacrum. I want you to raise that right side up again for me. Do you notice a difference?
Oh, yeah.
Easier to lift up?
Yeah.
Good. Yeah, so now I'm not saying that the sacrum was out by a lot of, pointing more to the left, but just that little bit of torquing it back to the right, you're able to raise your, that leg that much higher, so, and easier. What we're gonna do, we're gonna come back down here to the leg length. As you guys can see, completely even. So between the sacrum and then between that T1 and T2 adjustment, completely balance out that leg length. So what I'm gonna have you do, I'm gonna have you sit up for me.
Okay.
I'm gonna have you face that way for me. So we're gonna do that anterior thoracic adjustment here. And that rib is right in through here. Okay. So we're gonna start on top of that. I'm gonna have you give yourself a hug like this and over. Okay, so I want you to take a deep breath in and start exhaling out for me. I'm gonna have you lift you up just a little bit. Gonna go up. One more time, deep breath in and exhale out. Okay. Alright, I want you to relax just like that for me. Actually scoop forward just a little bit. Perfect, right there. Alright, so we're gonna go ahead with the Y-strap here. Now this, I know this is one of the main things on why you're here. Getting that manual decompression. So yeah, you're gonna feel this going all the way up from that occiput, going all the way down into that low back. Okay. And have you lift your head up? Good. And relax. Okay. Just relax your arms. There we go. How did that feel?
Very good.
You get that decompression. Good, good.
Yeah.
Alright, relax just for a minute there. Got a ton of movement with that one.
Yeah.
Alright, I'm gonna have you come on up. Good, good. Perfect. How did that feel?
Good. Real good.
Okay. If you were to describe that to anybody who's never had that done before, what would you tell them?
It's basically you can feel your vertebrae separating apart all the way down. It's really neat.
Good, good. Yeah, I know that. What that's doing is every level you've got nerves that are exiting the spine here. So what it's creating is you're taking pressure, you're opening up all the foramen where the nerves come out of. You're opening up all those spaces, so you're getting pressure off of the nerves. So I'll show you guys real quickly on the spine here. We'll come around here. So when you're doing that, you've got all the nerves these holes here are all called foramen. So as you can tell, you got nerves coming all the way from the low back, all the way up to the neck. When you do that decompression, you're opening up every vertebra going all the way down the spine. So when you take pressure off the nerves, it allows the body to function and to heal as intended. So that's the whole point. And I mean, as a patient laying there, obviously I know you're feeling a lot of relief,
Mm-hmm.
you know, a lot of pressure, a lot of, you know, relaxation, you know, just I mean, it's a huge movement. So now I want to check a couple things just to make sure that spot with the ribs is all right, because I know we got that spine, but I want to see if that rib went with when we did that adjustment. If not, we got a couple other things that we can get that to move with. But if it did, I mean, that'd be perfect. That's what you came for. Stand up for me. I'm gonna have you over here again.
Okay.
If you're to just
Still feel it in there, but it's definitely more
Yeah.
range of motion.
now, what hurts more when you're turning, or is it not?
It hurts more when I'm going this way. I can get right to about here, and I can feel something's pinching in there.
Okay, and then what about the other side? Anything at all?
Yeah, and I can feel it this side too, but it's not as bad.
Not as bad.
I feel I can get further.
Okay.
I would say it's somewhere right in there. Go a little higher. A little higher. That seems to be where it's coming from.
It's right here.
Yeah.
Okay. All right. What I want you to do, I'm gonna have you sit on the table, but I want one leg on either side of the table for me. Okay. So I'm gonna have you bring this arm just on the shoulder, that one on that shoulder. Okay. That was right in here, correct?
Mm-hmm.
Okay. So I'm gonna rotate you as far as we can go. There we go. Good. Relax right there for me. Okay. So we're gonna come through. I wanna make sure and relax all these muscles. So I mean, I know I heard that move. I know you obviously heard and felt, but yeah, let's make sure we get everything nice and relaxed. Really work on that side. What I want you to do, take your right hand and put it on the small of your back for me. Yep. So when he does that, when he puts his hand back there, it takes that entire shoulder blade and brings it off of the ribs. So it allows me to actually kind of get underneath a little bit. And that's what we're coming around with the hyperloop here. How's that feeling?
It's getting in there, that's for sure. A lot of tight muscles.
Oh yeah. There we go. Perfect, relax. How's that feeling?
Good. That's better.
A lot better with that? Yeah, even just that. So yeah, with doing that adjustment, because I know you heard that.
Yeah.
That one rib, we got a lot of good movement with it there, which was really nice. Now the whole thing is making sure we keep that rib in, you know, where it needs to be at that costovertebral angle, right at that junction. So that rib hooks in right where the spine connects, and it basically it'll sit in a groove. Now what could be happening for him is that when it's in there, when he gets that sharp pain, it could be popping out. So now that we've got it back in place, which is a good thing, we don't want that coming out. That's why I do more of that soft tissue technique, because we want to relax it, relax the muscles, relax the ligaments, and we don't want any stress or anything to pull that back out. Okay. Perfect. So yeah, I'm gonna go through at the end, and I'm just gonna do a little bit more soft tissue technique with you.
Okay.
But yeah, after that, yeah, you are all set.
All right.
How's that feeling?
Much better. Much better.
Good. Good.
Yeah. Thanks so much.
Very nice to help you out.
All right.
If anyone is looking to schedule an appointment, go right to the website, drjosephcipriano.com. Send me a message, and I'll typically reply within 1 to 2 days, and love to get you in here. Have a good one, everybody.